Hello, my name is Roger Climson, and like you I have experienced prostate cancer. And also like you, I know that the treatment of prostate cancer can cause complications, in particular erectile dysfunction and incontinence. But what you may not know is that even if the first line of treatment is not effective or suitable in your particular case, there are alternatives. Treatments that can be individually designed to suit your particular need. And that's what this DVD is all about. Here you will meet a number of eminent urologists, doctors and other healthcare specialists who will explain to you the numerous alternatives that can restore your quality of life. So take a look. I think you'll find it very helpful.
Put simply, incontinence is the involuntary loss of urine.
Urinary incontinence is a terrible incapacity for a man. Constantly leaking urine, wearing pads, wetting your pants, it's a terrible thing to live with. And happily these days it can now be fixed.
It affects pretty much all aspects of your life, particularly if you have severe incontinence, and some men may feel that they're housebound because of the difficulty managing this. That impacts on your relationships, it affects your mood, there's high incidence of depression with patients who have severe incontinence, and therefore it can be a really debilitating problem. You don't want to lose all hope if you're quite wet after a few weeks to months after prostate cancer treatment. The fact is, it can take 6 to 12 months to fully come good after treatment, and if your continence is still not there at 12 months, it can be fixed. Incontinence, unfortunately, is an increasingly common problem, particularly due to the increased awareness and treatment of prostate cancer and the potential side effects this can have. Depending on the exact form of treatment, the risk of incontinence can be as low as 1 or 2%, but some studies quote a degree of incontinence after prostate cancer treatment as high as 20 or 30%.
Urinary incontinence for men in particular occurs after cancer surgery, especially after radical prostatectomy for prostate cancer. Now, it is true that with better surgical techniques, it's nowhere near as common as it used to be, but it still happens. And for those men who are wet, it's important that they be properly rehabilitated.
After prostate cancer treatment, the mechanism of incontinence relates to a weakness of the muscle that normally is constantly contracted to stop your bladder from leaking. This muscle relaxes when you pass water normally and then contracts again. With surgery, the muscle itself may be damaged, or nerves that supply the muscle can be affected.
Men tend to stick their heads in the sand. They tend to put up with their problems. Incontinence is not a condition that men should put up with. The mainstay of therapy is a good history and a physical examination. And then with the appropriate investigations, we are left with causes that are easily and confidently treated by your urologist.
If a man has mild incontinence, vigorous pelvic floor training may well fix the problem. If it's mild to moderate, the new male sling is very good at stopping him leaking and relieving him of the need to wear urinary incontinence pads. The gold standard for incontinence is the artificial urinary sphincter. This is a device that's been implanted in men for nearly 20 years.
The artificial urinary sphincter has had excellent results, with patient satisfaction approaching 90%.
It comprises a small inflatable cuff that is positioned around the urethra, a small reservoir that is behind the pubic bone, and a small activation pump that's within the scrotum. The cuff is filled with saline solution, and that compresses the urethra and restores continence. When the bladder's full and the man wants to empty his bladder, he simply feels for the pump in the scrotum and presses it twice. This releases the cuff, the bladder empties, and the reservoir, due to elastic recoil, automatically refills the cuff. Urinary incontinence is a terrible thing to live with. It can be fixed. A man mustn't put up with it. He should see a general practitioner, be referred to a urologist, expert in this field of surgery, and have the matter dealt with, either with a sling or with the artificial urinary sphincter.
Well, one thing's for sure. Prostate cancer complications do not have to be an end to living a full and a vigorous life. Not if you do 3 things. Seek support and information from an organisation such as the Prostate Cancer Foundation of Australia, also from your healthcare professionals and in particular your urologist, but most importantly of all, together with your partner. Because together you can again find true quality of life. And I know from personal experience. So why not give it a try?